Hi, folks, and welcome to Rough Sleeping in London, Headlines, Challenges and Progress. Obviously, there's a lot going on across the 33 authorities, and it's important that we work together. With that being said, we have a briefing session today with Ben and Amy. They will introduce themselves. At the same time, they'll have around about 5 to 10 minutes to talk about their specialist areas, and after that, or during that even, whilst they're talking, you can put questions in the chat and we will come to the questions accordingly. I hope everyone understands that. We're on for 45 minutes, give or take, and hopefully you will be able to interact with our two fabulous speakers. Obviously, Ben is London Council's Principal Policy and Project Officer for Housing and Planning, and Amy is our London Council's Rough Sleeping Project Manager. So the two best experts we can have on the team to answer the questions today. So without further ado, Ben's going first and then Amy will come from there. Ben.
Thank you very much for the introduction, Darren, and thank you for joining this London in Brief session on rough sleeping. In this session, we'll give you an explainer on rough sleeping currently in London, what your borough's responsibilities and roles are in relation to it. And next, we'll highlight the key issues playing out in rough sleeping in London right now, the work that London councils, member boroughs and partners are doing to address these. Finally, we'll introduce you to some exciting new initiatives London's leading that you and your borough can get involved in. There's plenty of time for questions at the end in the Q&A chaired by Darren. So, what is rough sleeping? Rough sleeping is a substantial social challenge facing London and its local government, with 10,053 people recorded as sleeping rough for at least one night in the year 2022-2023, and 28% of all rough sleepers are found in London. It takes its toll on a person, and it's often connected with multiple disadvantage. We know the longer someone sleeps rough, the higher the risk they have of experiencing violence, poor mental and physical health, dying young, and alcohol and drug dependency. In addition, the cost to society and public services has been calculated by the University of Nottingham recently at £8,625 for just 3 months of a person sleeping rough. The government defines rough sleeping quite strictly in England as when a person is sleeping, about to bed down or bedded down in the open air, or in a building or other places not designed for habitation. Despite its impacts, there are some misconceptions and myths that exist about rough sleeping. If you do a search, stock images of rough sleepers are almost always middle-aged men with beards and carrying cups, but the demographics are in fact a lot more diverse than that. One way that we're exploring this is that London's pioneering work to show the experiences of women rough sleeping and how there are more than has been traditionally accepted through the work of our women's census. The first census carried out last year and repeated recently provided useful data to shape the response to women's rough sleeping and strengthen the evidence base around this issue. It's demonstrated that using more flexible methods of identifying people who are rough sleeping can highlight unmet needs. Another thing is far from all homeless people experience rough sleeping. This might seem obvious, but I heard at a conference last week people saying that they'd been talking to their families and, trying to work out how far do they understand the difference between someone who's homeless and someone who's a rough sleeper. But obviously rough sleeping is highly visible and it's a severe form of homelessness. It's the tip of the iceberg in terms of the wider homelessness numbers in London, which are much greater. Whilst one night on the streets is one too many, rough sleeping is also thankfully quite a brief experience for the majority of people, with over 70% of people only seen once on the streets due to services supporting them and self-help. Another myth that exists is that there is an overlap between street activity and rough sleeping. And although there is, far from all the people seen on the street in the daytime will be rough sleeping at night. And on the other hand, many Rough sleepers will conceal their status during the daytime. So, as we'll explore later in this presentation, Rough sleeping works in close connection with many of London's key challenges, including the housing crisis, immigration and asylum policy, safer communities, and health and social care. Just to give you a sense of the longer term trends and the scale of Rough sleeping in London, during the 2000s, Rough sleeping numbers went down and they were low by 2010. Less than 4,000 were seen in that year. Since 2013-14, there's been an upward long-term trend in numbers of people sleeping rough, interrupted only by a significant decline in 21-22 during the COVID-19 pandemic, in which emergency accommodation was offered to all Rough sleepers. Unfortunately, the latest annual statistics show a 21% increase from 8,329 in 21-22 to 10,053 last year. And this is driven by a range of factors, including the end of the everyone in accommodation, a lack of affordable housing, and the cost of living pressures that Londoners are facing. And so far, the last 2 quarters of data for the year are also showing increases. As you can see from the map on this slide, the number of Rough sleepers can vary substantially from borough to borough. Factors that drive the variation include how central the borough is, the pull of major train stations and transport hubs, areas with higher footfall, and sometimes a degree of provision of services by the local council. So turning to the role of London's local government in relation to Rough sleeping. London's boroughs have primary responsibility for supporting Rough sleepers off the streets and delivering services. This includes borough statutory homelessness services operating under the Homelessness Reduction Act, as well as targeted Rough sleeping teams with outreach workers who support people to get off the street into temporary accommodation and onto longer term, more secure housing. Another thing that our boroughs do is critically, every year London's boroughs provide emergency shelter and assistance to Rough sleepers during severe cold weather, which was recently activated, as some of you might be aware, over the weekend. There's a report on what we did last year and some of the growing pressures facing boroughs on London Council's website. Another thing London boroughs may do is commission homeless hostels. So funding wise, a lot of Rough sleeping work is funded by central government, although some does also come from boroughs' own funds. Boroughs receive the majority of funding, although unlike many areas in London, the GLA also plays a significant role and funds some pan-London services. The key funding streams currently are Homelessness Prevention Grant, Rough sleeping Initiative, which is commonly referred to as RSI, and Rough sleeping drug and alcohol treatment grants. Boroughs also work sub-regionally and in partnership with the GLA, NHS services, social care, service providers, charities, and DLUP.
Hi everyone, I'm going to talk about current challenges. So apologies, trying to do the slides at the same time. So given boroughs' responsibilities around rough sleeping, they now face a number of challenges. As mentioned, rough sleeping figures are increasing overall across London at the moment, very much driven by a combination of factors, including debt and tenancy losses, evictions by landlords, relationship breakdown, discharge from institutions, especially asylum hotels. And despite funding allocated and well-developed systems, the increased flow of new rough sleepers is putting a strain on our boroughs and services. A key challenge this year and into next year is associated with immigration and asylum policy. An increasing number of decisions is being made faster. And while it's welcome that the backlog of asylum applications is being cleared, the accelerated process is resulting in more people with positive decisions going onto the streets. A recent London Council's research has shown that there were 609 asylum accommodation leavers across London in September. These are people at higher risk of rough sleeping. Many of these people are young, sort of under 35, meaning it's difficult for them to access accommodation with benefit rules. Benefits can be delayed, often leaving people in destitution. They often have little or no support networks and don't have strong language skills. There are also challenges from boroughs to respond to prevent homelessness, which London councils have been raising to the Home Office, including issues with communication of where positive asylum decisions are made and the limited time to act. Thirdly, while services work hard to support people off the streets, housing scarcity and unaffordability are making it difficult for people to move on to secure long-term housing. Recent research by Homeless Link has shown that 40% of people living in temporary accommodation are waiting to move on, with 50% of those having been waiting for more than 6 months, and this can lead to shortages of temporary accommodation for those on the streets. Another major challenge, which we saw last week, is the provision of appropriate shelter and assistance to rough sleepers during severe cold weather. Last winter was challenging due to early, extended and repeated activations of SWEP, during which boroughs act to bring people inside to safety from the cold. So we may need to look to adapt and change how we respond to this in the future. And finally, there's a variation of what is available in each borough for those rough sleeping, such as specialist workers, so outreach nurses and social workers, and bespoke accommodation, such as Housing First and highly supported accommodation. Where there are limited options, those who are entrenched, who have challenging behaviour, can remain on the streets for longer. So how are boroughs and London councils addressing rough sleeping? So firstly, rough sleeping is an area London councils are very active in on behalf of members through supporting services, providing leadership, developing policy and lobbying government. London councils provides system leadership by convening the Life Off the Streets Ending Rough Sleeping programme, which is jointly chaired by Darren and the Deputy Mayor Tom Copley. This brings together partners to tackling rough sleeping, to identify interventions across the active work streams, to tackle rough sleeping, lobby and monitor the effectiveness of interventions. Boroughs are now working in strengthened sub-regional ways, enabling them to make more strategic bids for funding and to share resources and knowledge across boundaries. Another real success of the past year has been the improvements to data about rough sleeping that London councils have led on behalf of our members. London has led the way in adopting the new DLUC indicators for rough sleeping, and housing services have funded an internationally innovative strategic insights tool for rough sleeping. It uses AI to enable deeper understanding of rough sleeping, from interactions with housing services to time on the street and in hostels and temporary accommodation afterwards. This data should support decision making to better target spending, services and policy, as well as make the case for bidding for additional funding. We lead on the T1000 project, which brings professionals from across London's boroughs and other public services to support the most entrenched rough sleepers in London. We have also been very active in meeting with the Home Office to raise policy and operational matters with them, which has mitigated some of the impacts mentioned in the previous slide on rough sleeping and on boroughs. We also manage and support a sub-regional immigration advice service, which means immigration advice to people rough sleeping or at risk of rough sleeping and some emergency accommodation. We are continually working with our members and our stakeholders to develop new solutions and options in this space, with our efforts currently focused on an offer for asylum accommodation leavers. And we also support members to prepare for winter provision of emergency accommodation, and have recently held a meeting with housing directors on winter pressures. So finally, we just wanted to tell you about a new initiative that is the launch of the London Charter to End Rough Sleeping this Thursday. The charter was developed by the sector, including the Passage, St Martin in the Fields Charity, Groundswell and YMCA's St Paul's, with support from Bloomberg Associates, London Councils and the GLA. It brings together in one focal point a place for the public businesses, politicians and organisations to pledge their support to ending rough sleeping, to learn about rough sleeping in London and ways they can take action, and news about the Charter and rough sleeping. The Charter will be launched by the Mayor of London and has already been signed by our very own Darren Rodwell, kickstarting the campaign. From Friday, we would really encourage you to type in London Rough Sleeping Charter to your search engine and explore the website and consider signing the pledges. We are also hoping all London boroughs will show their official support to the Charter by signing up. And finally, just wanted to thank you all actually for taking your time today to come and listen to us. And yeah, if you have any questions, both Ben and myself are here to answer them.
Brilliant. Okay, right. So there's 29 people on the call today, which is great. So that's nearly all the boroughs represented. Or 31, we've gone on to 31. Okay. I can see that we have someone who wishes, we did ask if you could put the questions, type the questions in, that would be great. So if you've got any questions, to type them in rather than people asking questions over this medium. So if that's at all possible, could I ask you to type in? On that note, though, whilst everyone's busy typing, because I'm sure there will be lots of questions, what would be, Ben and Amy, what would be your number one sort of request for councils to concentrate on, certainly over this period? What should councils be focusing over this winter period and then into next year? So I don't know who wants to come in first.
Yeah, I'm happy to have a go at that. That's a great question, Darren. I think at the moment with the winter, the severe weather emergency protocol and the crisis at Christmas that runs every year, I think a really great area to focus on for boroughs' rough sleeping teams would be taking opportunity of that moment of engagement with individuals to work with them towards longer term housing and support. So that's the kind of following up on the sort of in for good principle. So I think that would be a great area to focus on, would be trying to get the outcomes for those individual people who are helped during the winter time as good as possible. But I don't know if maybe Amy's got anything she would like to add to that.
I would sort of say it's so hard to just pick one particular area. I do think obviously with the cold weather, the emergency sort of shelters is really important. So it's getting people inside at the first point and making sure that in your boroughs having a range of options for people. I think I kind of touched on it as a bit of a challenge, but it's making sure that not everyone's the same. So making sure there's a range of options for people going in, and then that makes it even easier for us to keep people in and support the outreach teams.
And I think maybe more kind of policy wise, something that which we're really passionate about is prevention of rough sleeping as well. So that's sort of the hardest thing to do, but it's also the most important, and we know that it will have the greatest impact if we can move more of our work upstream instead of dealing and helping people once they're on the street. So that's around homelessness prevention, I think, would be another great area to focus on. London councils have been sort of investing in this, and there is some work that the boroughs have commissioned actually around how we can risk assess people's risk of rough sleeping. So hopefully working with DLUC next year, that might be something that could come on stream as a tool, and boroughs sort of handbook to be able to work with.
Brilliant. Thank you very much for that. As I said before, the question and answer tab at the Q&A at the top, if you want to put questions in, we've got 2 questions. So the first question was, where can we find the statistics on those who are homeless, not just rough sleeping, per borough? That's a very interesting question. And I know the statistics are there. So Ben, this is one for you probably.
Yeah, great. So I know Councillor Patel, you said all homelessness figures. So I think for the best place to look for that would be the Department of Levelling Up Housing Communities website, and I can share a link to that after the meeting if that's helpful, Councillor Patel. But we also have a really rich data set for Rough Sleeping specifically as well, and that's on the GLA's website, and that's called the Chain CHAIN database. So that's on the Rough Sleeping side.
And we'll have the email addresses of all the councillors that are on today. Can we make sure both of those are sent to all?
Absolutely, yeah, that's a good idea. We'll circulate.
Yeah, that just makes it a lot easier then, doesn't it? Okay, so our next question. Rough sleeping is only subject of homelessness in Richmond, and I suspect other outer London boroughs. We have unknown number of van dwellers. Any suggestions on how we engage with them effectively? Oh, that's an interesting one. We don't normally have vans in Barking and Dagenham, but we certainly do have rough sleeping. So, okay, I don't know, Amy, would this be more of your expertise?
Yeah, I can have a go at that. I mean, obviously, outreach teams don't just cover people on the streets; they will cover people that sort of sleeping in cars, and vans will be one of those as well. I mean, I don't hear about vans as much, but I mean that's probably because I'm not on the ground so much with that side of things. But people can make referrals in using the number plates of cars and identifying parts of those vans. So outreach teams will receive those referrals and they'll sort of go and visit those people and sort of work with them pretty much in the same way as those that are on the streets.
Funny enough, I did one only yesterday in my own borough, and it was a car, and I got the number plate of the car, and the team went out and saw the person last night. So
that's really good to hear.
Oh yeah, no, it's very good. I was
very quick.
Yes, yeah. Okay, so we have another one in. Thank you for saying you think it's very interesting. That's good, and you have some thoughts. So, in what ways can councils work more effectively with the health services? This is a good one on identifying and address issues of homelessness. Instance, outreach services, going to A&E departments. Other areas around this. So, what work is being done effectively? Good examples of local authority with NHS partners. And again, I know we're doing a lot of work around this, so both of you could probably say something on that one.
Yeah, definitely. Great question, and you're right to identify that as an important area to focus and improve work. And so Life Off the Streets group does have a dedicated work stream to this, and we've got system leadership bringing together at a range of operational and strategic levels. Both partners from the NHS specifically looking at that, and also from housing departments as well. There are these things called pathway teams which do work to try to join up between housing department, the individual in question, and hospital departments. So there's some work there, and an organisation called Pathways, which is a bit confusing, recently released a report which was looking at how that's going across the country and had some recommendations. So there is some funding and some work that's going on both in London and nationally around that. But it's sort of an area that we know we need to do more. We held a conference, a kind of summit in September, which was bringing together the health colleagues, social care colleagues, and housing colleagues earlier, but on a kind of sub-regional basis. And that was the beginning of that conversation in terms of connecting those people. So hopefully next year there'll be some work that will come out of that to kind of add to what's going on already. So that's the sort of health side of it.
Okay, Amy, do you want to add anything to that?
No, I think I agree with Ben that there is a lot of work going on around health. There's lots of different sort of forums and that, and we're very much involved in those ones, and just looking at how we can better improve communication as well between health services and outreach services as well, making sure they're getting through to the right teams quicker, and it's all about collaboration between the two services.
No, absolutely, and again, bearing in mind I chair that grouping that you're talking about, Ben. Yeah, no, a lot of work's going on around that. It's interesting because that comes into the second of the three questions, and that was, again, you talked about pathway and accessing and provision and all of that. Hopefully the processes are pan-London now, pretty much, because of those pathway teams. Ben, do you want to talk a bit more on that?
Yeah, about the verification, Darren. Yeah, it's a really interesting and kind of slightly thorny issue, that one, because you know, as I was saying earlier, everyone sort of agrees that it's great. It would be great to work further upstream and prevent before you get to the point of someone being on the street and being verified. But at the same time, we do have these often fantastic services which are dedicated for us sleepers. So we're kind of exploring across London, the councils, London councils, GLA, and DLUC. We're kind of exploring how we could reform that process of verification that the council is referring to there, recognising that have to be careful how we do that. And there are some services which obviously will need to be still require some kind of checking of people's you know, status. But we want to make sure that people don't have to rush sleep in order to access services, and you know, people who are homeless, we'd like to see that, you know, their homelessness is treated as other people's is, in terms of you know, Homelessness Reduction Act and statutory. So yeah, it's definitely one for the future, councillor, to look at further, I'd say, in terms of verification.
Yeah, because I mean, we are. I mean, the services, we're trying to make all of these services pan-London, isn't it? And any change to service, again, making it pan-London, so it shouldn't matter where people show themselves in the first instance. The support's there, no matter what. And talking about support, the last of the three in there was the feedback on the recent changes to StreetLink's referral system. There's no longer a reference number, which for agencies making referrals make it very difficult to liaise effectively with outreach teams. So I'm not aware of that. I don't know if Ben or Amy, whether you know anything about that, but it may be something we may have to go and investigate, because obviously it's always easier if you've got some sort of reference.
Yeah, I think that's probably one that's best to be explained. We can sort of take the details of the person who asked that question and give them some information about that, because it's quite complicated. Essentially, as they might be aware, the service was recommissioned a few months ago, and that meant the model changed slightly. There was also a new website as well, and the way that people can refer into that change. So it's probably best if we take that one away to provide some information, because it's a bit complicated, and I wouldn't say I'm the best expert on it myself.
Well, as with everything, things change when you go out to procurement, don't they? So, but it's again making sure that agencies cross organisations are talking the same.
And what I guess what I can say as well is, because of that new contract, I think there's been a few teething troubles. I went to StreetLink myself last week, and I think that the GLA and DLUC are sort of aware of that issue around the reference, so they're working on it. But we could provide some more information if that's helpful to the person that asked the question afterwards.
Yeah, no, that'd be good. And actually, someone else is now coming in, haven't they? Said not having a reference effectively is a backward, retrograde step. In their view, I think we could agree with that. So maybe that's something we need to take away. Well, not
certainly can take the feedback. I mean, obviously, London Council is, just to be really clear, we're not involved in that process at all. That's a GLA sort of DLUC decision, but we can certainly deliver that comment back to them. So thank you for making that, Pat.
And I think we've got a meeting with one of the ministers shortly, actually, haven't we?
Next week. Yeah.
So we'll make sure that's brought up in the meeting. That's good. Okay. I've been very keen to have a conversation with Ben. Okay. All right. George, I'm sure Ben will talk to you outside of this meeting, like he's just said anyway. He'll make contact. That's not a problem. Okay. Do we have any other questions? The preventing homelessness for me is the mainstay of what we try and do as a borough, it's fair to say. And we've been using a lot of data analysis around this when it comes to people's financial viability in being able to afford their rent and other issues. I know other councils are doing similar things as well, and we've now got some tech equipment in other boroughs to do with damp and mould because of heating their homes. So there's a lot of work going on around this. Is there anything else that either of you, Amy or Ben, you could sort of say that councils are doing that I'm not aware of, or colleagues are not aware of, that we should be publicising? As both are on silent. No, Ben's just taking his. Go on, Ben.
Yeah, no. I mean, I think it's amazing how each borough, although it works sub-regionally, it's also got its own strategy. So I do think that there's an amazing amount going on, which I wouldn't be able to detail now, but I do think as flagged up, there's some great work going on around the information that we have about rust sleepers, and that should help to even better inform services moving forward. So the fact that we've got all London boroughs signed up to this amazing new data tool for rust sleeping, that's a really exciting thing, which we haven't really shouted about, but I think it is going to be hopefully quite transformative. I think we have to just celebrate really the hard work that our local authority rust sleeping workers are doing every day to deal with a really difficult situation out there on the streets with people, as Amy flagged up, who are just recently arrived to this country, just received like a positive decision to give them refugee status, and so councils and workers are working really hard to support those individuals as they come out of hotels, or prevent them from going onto the street out of those hotels. So yeah, I think those are a couple of things I'd flag, the sort of the heroic efforts that are going on this winter, and the strategic data piece that they're also working on as well.
Yeah, no, I agree. I mean, our frontline services across sectors, so local authority and voluntary third sector, I mean, the work that's happening is tremendous. Unfortunately, it has to happen because we are in this situation. Okay, there's one that says people with no recourse to public funds. Some are the most expensive to help, especially those that don't qualify for housing benefit. Any chance that they're going to be treated more generously by the government? I have to say, I fear not. I think government's made it very clear where people with no recourse to public funds stand in their concern level. I'm not aware, talking to ministers and officials, I don't know, colleagues, if you have any other news?
No, you're quite right, I'm afraid. It's important to sort of be really clear that not everyone who people think might have no recourse actually do. There are, often people do have recourse to something, but if you are really strictly speaking no recourse to public funds, unfortunately, we can't see that changing in terms of their ability to access things. So no, I'm afraid not.
And that's where we very much rely on the churches and other faith organisations and voluntary sectors to come in and just do it on humanitarian grounds, I think it's fair to say, because we can't as a state system, which is a real shame. Another one. Sorry, go on, Amy.
I was just going to add there that it is expensive to help those people, but it doesn't stop the work from outreach teams. I think they're still engaging with those people and making sure that they're checking their health and always exploring where someone might qualify for additional benefits or services. So it's something that's continuously sort of being assessed by teams.
yeah, this takes nothing away from the teams, because I know the teams are still engaging with all persons, no matter their backgrounds. I think that's the most important thing. We want to do more. We're just being told we're not allowed to do more. So that's where we've got to work with our partners. And it actually, someone's mentioned it in Merton, working with Salvation Army, street pastors, police, NHS, homelessness, shelters. We're all doing the same in different guises, and it's great how the community rallies round at this time. But there's still a lot more that needs to happen, and that brings us on to a concerning increase of hidden homeless travelling on the transport network at night. Are they slipping through the net? Now, again, I know that we do some work around that. I don't know, Amy, would you like to talk about that at all?
Yeah, sure. There is actually a specific outreach team that takes referrals for people on public transport. So it's always good to know if there's someone like that, there's a team going around, and the more information you know about someone, if you regularly see someone on a bus or a particular sort of bus route or a particular tube line or anything. But I know that those teams also have very good contacts with London Transport, so they're always feeding in, because you will find that a bus driver does, they recognise people that are potentially rough sleeping, if they see the same person every night on a bus. So there is a specific team that goes out, and yeah, there's always thoughts of those at clients.
No, absolutely. Again, we've got George has come back in talking about the good practice recommended regarding commissioning for this group. So I gather it means the not having funds, no recourse to public funds. We're good at identifying, but saying we fall down long-term funding and intervention support. If that's for no recourse to public funds, certainly, because they're not allowed to get our state help. And longer term, obviously, we do have people that no matter how, until they are ready in themselves to engage, it's very hard for us to get people to decide what they want, even though we think we know what's best for them. So it's a really difficult one. Asylum, I just know 7 days notice. Okay, so all right, I'm just reading that very quickly. Again, the whole issue around asylum and what we're seeing with the hotel decanting, I think it's fair to say. I can tell you that we will provision what they are decanting from, is what I'm hearing. Those very same hotels will be asked to facilitate at a local government expense rather than a national government expense, is probably the simplest way as I can put it, talking to other leaders in this area. Again, Ben, Amy, I don't know if you want to say anything on this.
Yeah, regrettably, I'm sure you're right about that part, about the provisioning side, and in terms of what we're doing to raise it, then we've been very active raising issues around the asylum decision process and the ending of accommodation across the year. We work across within London councils and with our members and with the GLA as well. And I think we've written to the Home Office on a number of occasions, to ministers and to officials, as well as trying to establish operational closer working. So we are very active in this space, and we have raised issues around the amount of time that people are given to vacate, including quite recently. But we're going to keep working hard in that space, because we think obviously it's a really critical area, as you rightly point out in your question.
Absolutely, and I can say that's cross-party as well. So this isn't just one part of London councils, this is the whole of London councils saying we are all concerned. And again, I can reiterate that I've signed a number of letters, and again, it's coming up in conversation with departments. Amy, I don't know if you want to come in.
Yeah, I would just sort of say, in addition to that lobbying side as well, I think London councils together with DLUC and GLA are also looking at options for that group of people. I think I mentioned it in my section of, offering some initial support as well. So can we sort of support them getting into accommodation, work, and that side of things?
Yeah, there's a lot of work. It's not going to stop anytime soon, that's for sure. Okay, I think just under 30 minutes, you've gone through quite a number of questions. Is there any other reflections that you would like before we close the session today that you'd want to mention?
I mean, just to say thank you so much for attending, during probably your lunch hour and a busy day. And I hope that the session was informative and useful. And we'd really welcome, value any members' feedback, questions, comments, input from you after the meeting. But just thank you for taking the time to listen to the work that we're doing at the moment.
Amy?
Yeah, I would thank everyone as well. And just to sort of say, if you do have queries about your local boroughs, you've got great rough sleeping leads across London. They've got a lot of knowledge. They'll be able to answer any questions you have about your specific stuff. But I can sort of say from the meetings I have, I'm always impressed by how hard they're working. And I think, my key thing is that there's so much collaboration going on, and it's just, please just encourage your boroughs to look at that, to kind of not just focus on their boroughs and sort of, it's all about joined up working. It's a difficult time, and I think it's just about kind of building on that great work that everyone's doing.
Again, thank you for saying that. I totally agree. We have a really good partnership, officer member partnership in this area, as well as sector partnerships as well, with other state partners and also the voluntary sectors. And, there's a lot of goodwill and hard work happening out there. And as the lead for London in housing and homelessness, and the good stuff is the regeneration, because we need more homes. Actually, this is number one on our priority list. That's why we keep talking about how many people are homeless in London today. And it's sad to think that we are in the same sort of situation we was 100 years ago when the Greater London Authority was built. And, we need to have that joint effort again, one, to work on the immediate, but two, to work on the real issue, which is having more homes so more families can have permanency in this great city of ours. So yeah, only leaves me to thank you all for joining today. Ben will send round those links, and Amy and Ben would be more than happy to, again, answer any questions. But please go back to your respective boroughs, talk to your housing leads or officers if it's not your flag that you're flying under. But even if it isn't, then I would talk to them, because this is a cross-party concern, and we need to work as one on homelessness. We've got to eradicate people sleeping rough on our streets and people being in any form of homelessness across this great city. Anyway, thank you for coming on, and hopefully we'll see you again soon. Bye for now.